Here's a USMLE style question on posterior urethral valves, PUV. A 2-day-old male infant is brought to the emergency department by his parents due to difficulty urinating, abdominal distension, and lethargy. The infant was born at full term via normal vaginal delivery without complications. On physical examination, the child has a distended abdomen and there is palpable bladder fullness. A bladder catheter is inserted and only a small amount of urine is drained. Ultrasound of the kidneys shows bilateral hydronephrosis and bladder dilation. Avoiding cystourethrogram VCUG confirms the diagnosis of posterior urethral valves. Which of the following is the most likely long-term complication of this condition if untreated? A. Chronic renal failure. B. Renal cell carcinoma. C. Nephrolithiasis. D. Recurrent urinary tract infections. E. Vesicoureteral reflux. Answer and explanation. Correct answer, A. Chronic renal failure. Posterior urethral valves, PUV, is a congenital obstruction in male infants caused by the presence of abnormal folds of tissue in the posterior urethra. These valves prevent normal urine flow, leading to hydronephrosis, bladder dilation, and eventual kidney damage if not treated. Chronic renal failure is the most significant long-term complication of PUV if untreated. The obstruction increases bladder pressure and causes backflow of urine into the kidneys, resulting in hydronephrosis and progressive renal damage. Over time, this can lead to renal fibrosis, scarring, and renal failure. Why not the other options? B. Renal cell carcinoma. Renal cell carcinoma is a malignancy that typically occurs in adults and is unrelated to congenital obstructions like posterior urethral valves. It does not have a direct connection to this condition. Nephrolithiasis, kidney stones, is not a common complication of posterior urethral valves. While it is possible to develop stones due to altered urinary flow, the primary issue with PUV is the progressive renal damage and hydronephrosis, leading to chronic renal failure, not stones. Recurrent urinary tract infections. While urinary tract infections, UTIs, can occur in PUV due to impaired bladder emptying and stasis of urine, chronic renal failure is the more severe and common long-term complication when PUV is untreated. UTIs are generally treatable, but do not lead to the severe outcomes associated with untreated PUV. E. Vesicoureteral reflux. Vesicoureteral reflux, VUR, can be associated with posterior urethral valves, but it is not the primary long-term complication. Chronic renal failure resulting from hydronephrosis and progressive kidney damage is the most concerning complication if PU is not managed promptly. Key takeaways. Posterior urethral valves, PU VUVs, are a common cause of congenital obstruction in male infants, leading to hydronephrosis and bladder dilation. If untreated, PUV can result in chronic renal failure due to progressive kidney damage. Early diagnosis and intervention, typically with catheterization or surgical correction, are crucial to preventing long-term complications. Let me know